Okay, so now that we know all this stuff now, we know that we've got all these components, all these little pieces, all these cells, all this material that's in our blood. So when something happens, when we have a breach, whether it's a breach internally or it's a breach from the inside world to the outside world, we're going to find that we have three mechanisms for correcting this breach that the body wants to go through. The first thing we're going to do, we'll have a vascular spasm, meaning because we broke the vessel, it's almost like it goes, oh, okay, literally a vascular spasm. We're not aware of it, okay? But what it's going to do, we're going to get the constriction of the broken vessel. We're going to see, we're going to be learning blood vessels are smooth muscle. Now, what this means is when we get to this level right here, if we're thinking, let's think about our paper cut, okay? Because that's going to just be the little capillaries. So when we breach that, it's only a single cell layer thick at this point. So what we need to do is we need for that vessel to constrict. We've got the injury to what we call the smooth muscle because that's what it is. And we want those platelets to arrive and we want them to begin to help constrict this broken vessel. So they release their chemicals. Serotonin is one of them. It helps to make this break that occurred begin to do this number right here. And as those materials continue to rush to the area, we're going to see the healing begin. But before I go any further, looking at this picture right here, do you guys, because I mentioned it before break, the fibroblast, okay, and how we have those fibroblasts in the blood and they're traveling. Now remember, because they are a blast, they give rise to. So they give rise to fibers. What do you notice about the break in the vessel in this picture? Does it look fibrous? Yes. This is why we need those fibroblasts, because they will come in and they will help with that healing. Does that make sense? So the first thing will happen, we'll have the vascular spasm, we'll get materials released that are going to help with constriction, and the next thing that's going to begin to happen, we're going to form the platelet plug. So all of those little fibrous pieces that we're doing this number, well, because we have fibroblasts, they get to come in and we get to form a mesh. And that mesh will capture these cell pieces, fragments, platelets, okay? It'll begin to capture them because these fibers, do you guys remember collagen? Okay, and then we have reticular and elastic for the other fibers in the body. And look what happens. Platelets get to form, stick together at this broken portion. This creates our platelet plug. As these platelets get stuck and some of them begin to break down, that's releasing materials that are in the platelets. They are releasing, do you guys remember, the procoagulants, blood clotting factors? Okay, they're releasing their materials. Now, here's where it's a positive feedback system. For the most part, we work on negative feedback. This process right here, in the beginning, is positive feedback. Because if we can get the platelets there, the platelets call up more chemicals, which will bring more platelets, which will call up more chemicals. Do you see where I'm going with positive feedback? But we really need that process to stop. Under normal circumstances, the other, when I say other, clotting factors that are going to get called up, okay, they will come in, platelets will stop releasing all of their materials, and we stop the positive feedback. And it's fine. Hopefully, once we have clotting factors, once we get our platelet plug, the next thing we need is the clotting to occur. Note, these platelets and blood pieces and everything, they're kind of contained in the mesh. This, of course, clotting factors that will come up, all right, will help this process to continue and healing to take place. The process is extremely difficult. There are over 30 chemical reactions that occur with the clotting factors. Your textbook, I think, is going to go into great detail over the clotting factors. I'm not going to get you to get into that great of detail, okay? But clotting factors are important. I'm sure that you all have heard of something called hemophilia, okay? This is where people are deficient in certain clotting factors. The issue with clotting factors, even though we have all of them involved, they have to reach what we called a common pathway, meaning the blood clot forms, okay? People who are deficient in any of them that lead to that pathway, or any of them that are deficient after the pathway forms, are not going to form the clot. They're not going to stop bleeding. They're going to continue bleeding, all right? They may have to go to the hospital, get the clotting factors, and they're usually fine, okay? Depending on the seriousness of the disorder. So over 30 reactions are involved. And our goal, okay, take materials, that fibrinogen, fibers, okay, get to what we call fibrin so that we begin to form the mesh catching the clot, okay? And so the process, like I said, we need to get to a common pathway. So the reactions that take place for that blood clot to form, for the bleeding to stop, okay, all of those reactions are going to be dependent on these clotting factors. Did you see how we have like factor 10, 9, 8, 7, all that sort of stuff? Doesn't mean that's the order they occur. That was the order they were discovered, all right? But the goal, get to my common pathway. So I can have this extrinsic mechanism. I can have intrinsic. Extrinsic simply tells me it's from the tissues surrounding the breach. My extrinsic pathway mechanism, because like I said, your textbook's going to get into great detail. Extrinsic is simply the process occurring in the tissues around the breach. Intrinsic, what's in my blood, the actual blood flowing. If both of those pathways are working correctly, I get to my common pathway. Hemophilia, for the most part, is occurring in these pathways, specifically this one. We do have some hemophilia that occurs here, but a lot of what occurs here, if something goes wrong, it's because something goes wrong with thrombin. Now that's a term that you're going to hear when you get out into the clinicals and dealing with patients. And this would mean that their blood is not clotting correctly. They may have to go have tests done because they do what's called a prothrombin time test, a PTT, okay? Under normal circumstances, for example, the paper cut, how long do you bleed? A couple of seconds. At the most, 30, 45. Because under normal conditions, the clotting factors, this process, the vascular spasm, all of this sort of stuff should be in place healing. If it doesn't occur, like for example in under a minute, something's wrong. And that's usually when they'll have to continue watching the patient and eventually have to maybe do the PTT test. Because if these factors work correctly, one of the things that we need for this blood clot that got formed at the breech to do, we need it to dissolve. And believe it or not, if this doesn't form correctly, the clot cannot dissolve. So if we cannot get to our point of the fibrin and the mesh, we can't break it down. We can't break a clot down that formed. What can it possibly do? Okay, think of a pulmonary embolism. We could have it go to the brain. We can have it stop up a vessel in the legs, the arms, the hands, the knees, the thigh. You see where I'm going with this? So, if these clotting factors work correctly, hopefully we are going to find them do their job and form the clot, let the healing occur, let the clot break down, everything dissolve, and life goes on just fine. All right? Now, in these factors, in the plasma, we need them to remain inactive. Why do I need them to remain inactive until needed? If I don't need them and they begin to activate, what's going to happen to my blood vessels? They're going to clot up. What's going to happen to my blood flow? It's going to stop. What's going to happen to the tissues? They're going to die. Now, what do you notice being important for this to work? What ion do I need to be present? Did that not just show up earlier today? Now, think about that too. You guys know what to believe in? Okay, so when we have the breach and those platelets release